Hi everyone! Sarah, Rose, Maeve, and I have been collaborating with Molly and with students and faculty from the Department of Nursing to develop a training program to administer to clinicians in the emergency department at Rush in order to increase the number of individuals with intellectual and developmental disabilities who are properly coded among admission to the ED. Although we know that individuals with IDD utilize healthcare services more frequently than the general population, one of the limitations consistently cited by researchers indicate that not all adults with IDD are identified within the hospital population. We are exploring the hypothesis that this discrepancy may be a result of improper coding upon admission to the hospital. Lack of appropriate coding is problematic because it impacts clinical care, prevents researchers from having a comprehensive understanding of this population, and impacts reimbursement. In order to combat this problem, we have teamed up with a coalition of healthcare professionals to develop a training program to aid practitioners in the ED in correctly identifying and subsequently coding these individuals. Before explaining our proposed intervention, it's important to understand some background regarding challenges that this population faces when receiving healthcare. Discrepancies in identifying intellectual and developmental disabilities contribute to the lack of coding and subsequent lack of effective treatment and prevention planning. For the purpose of this study, IDD will be viewed as a joint health condition and defined as follows. Disorders that are usually present at birth and negatively affect the trajectory of the individual's physical, intellectual, and/or emotional development, many of which affect multiple body systems. Additionally, there is a lack of general healthcare provider knowledge regarding treatment of this population due to lack of education and training, communication challenges between practitioners and patients, and exclusion from large health surveillance research efforts. Part of this lack of knowledge stems from the history of segregation of people with IDD from community healthcare settings. It wasn't until the 1990s that they were deinstitutionalized and able to live in residential-based communities. Finally, it's important to recognize that this population is more likely to use the emergency department as their point of access to receiving healthcare. Individuals with IDD use the emergency department as an access point to receiving healthcare at a rate of 38% of all of their hospitalizations, as compared with the general population at a rate of 20%. For this reason, we chose to focus on coding in the ED. To accomplish this, we are using a pre-post study design to identify if advanced level practitioner education about secondary IDD coding increases IDD coding in ED admissions at Rush University Medical Center. Advanced level practitioners are responsible for documenting the patient's diagnosis and relevant secondary diagnoses in the problem list in the ED. For this reason, a convenient sample of advanced level practitioners will be recruited from Rush University Medical Center's emergency department and will specifically target physicians, including residents, fellows, and attendings, nurse practitioners, and physician assistants for the training. An email will be sent out to the participants with the website link to access the online curriculum and learning assessment. Data will be collected from Vizient's clinical database, a national database of academic medical centers, their affiliated hospitals, and other community hospitals. Diagnosis codes from all ED admissions at Rush University Medical Center from August 2019 to October 2019 and August 2020 to October 2020 will be collected. Individuals will be identified as having IDD if the following ICD-10 codes are present: intellectual disabilities, F70 through 79, pervasive and specific developmental disorders, F80 through F89, congenital malformations of the nervous system, Q0 to Q7, and chromosomal abnormalities, Q90 to Q99. This training will be online and will be designed for practitioners to easily access and understand. Principles of adult learning suggest that the adult attention span lasts less than 20 consecutive minutes, or under 15 minutes in length. Investigators will administer training as a trial run to 2 to 3 expert physicians to review training and provide any needed feedback. Any suggested input will be incorporated before training is administered. Investigators will be available remotely to provide feedback and answer any questions. The percentage of individuals who are coded with IDD will be calculated before and after the training is delivered. An independent t-test will be conducted in order to compare the two samples. There are several challenges we must consider given the circumstances of the pandemic. Because the ED has been overwhelmed by COVID patients, employees, specifically the advanced level practitioners, have faced an overwhelming amount of stress. We have to consider their time and willingness to complete this training module, as well as their bandwidth to take in new information. Our attempt to control for this situation is to keep the training very straightforward and short. The entire module will take under 10 minutes, with the primary takeaway message being code for IDD. We also intend to keep the training available over a long period of time, with the opportunity for continued feedback. Therefore, we can respond accordingly to their needs. Another potential challenge we must consider is the changing demographic of the people entering the ED in light of COVID-19. Many individuals, including those with IDD, are more hesitant to go to a hospital because of fear surrounding the virus. This changing demographic may impact the number of patients that need to be secondarily coded for IDD. However, we know that COVID has affected this population as much, if not more, than the general population. Because many live in group homes and have compromised immune systems, they are arguably more likely to enter the ED during these times. Consequently, we hope that the urgency behind coding is understood in light of the pandemic and beyond. Outside of the ED system, an additional challenge of this project is the interdisciplinary team. We are currently working with nursing students that are expected to graduate in August with a completed capstone project. Therefore, they need to roll out this training and get feedback by the end of June to produce a finished quality improvement assessment. Because our timeline and expectations are different, we plan on continuing the online curriculum past their deadline with hopes to publish and present our results. We want to make a positive change in the ED, so we cannot rush this training. This requires extensive interdisciplinary communication and frequent meetings with all students and advisors involved. We are optimistic with the direction this project is headed, but it will take time, patience, and persistence on our end to make it happen. Thanks for watching, and wish us luck.